All right, National Health Center Week just wrapped up at Great Lakes Bay Health Centers, a time to recognize the incredible impact community health centers have on millions of lives across the country. And joining us this morning to tell us more, we have Angela Williams from Great Lakes Bay Health Centers, and we appreciate you being here. So many heroes in the healthcare system, really, saving lives every day, and we should probably start with what you want people to know about healthcare services.
Well, what we want people to know is I'm sure they're hearing on the news the changes that are going to affect our Medicaid patients. So we want to remind everybody how important it is to get seen for care. And what people don't realize through Great Lakes Bay Health Centers is that we're a community health center and we offer whole person care. What does whole person care mean? It means that you can get your primary care. If you have a chronic disease, we can manage that, your immunizations. If you walk in and you are not feeling well, we can offer services that day, hopefully. Behavioral health services, dental care, pharmacy. Our pharmacies actually are mailing prescriptions to patients as well as having a driver to deliver those medications to our patients. And we have this new courier system where even if you live outside of our local counties, we can mail the next day you arrive. That medicine will arrive at your doorstep.
It's impressive.
Yes, but the services are restricted to Great Lakes Bay patients at this time. And don't forget that we have women's health services, including doula services. We've had doulas now for 2 years, and it's phenomenal that the doulas serve as a liaison with the pregnant mom and her family, as well as our medical providers, and it is a successful program that's influencing our maternal infant health mortality in especially Saginaw County and Bay counties.
Could you remind us what that program is?
Our doula program, a doula serves as a liaison. She is specifically trained to serve, well, first of all, she has to be trained to understand the pregnancy from a healthcare perspective, but at the same time, emotional support, recognizing symptoms, and also helping to empower that family to ask those important questions about pregnancy.
All right.
In addition to that, pediatric and adolescent health care. Many people in the community still aren't aware that we have school-based health centers where your children, if they are on Medicaid, we can see your children ages 3 to 21 at our local school-based health centers, which sometimes you can't get into your pediatrician or your family practitioner, and you can make an appointment with our nurse practitioners and be seen at one of our schools in Saginaw, as well as Bay City Central in Bay City. And in addition to that, transportation. If you're struggling and you can't get to one of our sites, we do have transportation available, and sometimes there are challenges with even our own transportation, but a lot of people don't realize that their healthcare plans, some healthcare plans cover transportation. And most importantly is we have nurses who are called care managers that coordinate your care and help educate you on significant medical challenges.
That's wonderful. It really is one-stop shop, isn't it?
It really is a one-stop shop.
If
yes.
we could go back, you mentioned the kind of the confusion around Medicaid. So if someone has Medicaid or had it in the past, can they still come to your centers for all of these services?
Yes.
Okay.
We want people to realize that the door is not shut. If you have Medicaid or you lost Medicaid, there's so much confusion right now, but whether you have coverage or not, renewals are starting back, and we have the capacity to help you. If, say, you lost your Medicaid, we can help you either renew it or identify a health care plan that you can still seek some coverage for care. And if not, we don't deny services regardless of your ability to pay. But at the same time, Medicaid, we can check that status for you because our healthcare system is so confusing these days for any type of insurance, but we don't want you to miss your healthcare needs because of paperwork.
Yes, you cannot take your health for granted.
No.
Things can change so quickly.
They can change very quickly.
And you know, when we look at Great Lakes Bay Health Center's messaging, it's we change lives because we care. So how does that play out within your system?
Well, we want to earn trust. Our staff genuinely care about our people who we serve. We want everybody to stay well, but we want you to know that we can support you. We don't want you to wait. We know that life is just complicated. So our team is trained not only to help you navigate the healthcare system, but things like I mentioned before, your insurance, transportation, social needs. We have community health workers who can refer you if you're challenged with the rent or food needs, other social services needs. We can provide that. We are that one-stop shop. So we encourage everyone, don't wait, don't guess, don't go without asking questions. Get your prescriptions while you're seeing your physician. We actually are state-of-the-art now where if I'm in a room with my doctor and he prescribes medication, we are trying to be as efficient, and if you're in one of our centers where we have a pharmacy, you can pick up your medication before you leave the building.
Oh, that would be so nice.
Yes.
That is so nice.
Yes,
saves an extra trip.
It really does, for sure.
And you're saying even if someone's not sure about their insurance coverage, you have people here to guide them through this.
We have people who are experts in guiding them.
All right, wonderful. Anything else you want to add? Maybe I have to ask about your great glasses.
Well, I have to make this announcement because it's so exciting that yesterday we showcased our brand new mobile vision unit.
Oh, wow.
We had a celebration at James Street, and our vision center now will be mobile, just as you see our dental mobile units driving down the streets of Saginaw and other communities. We will kick off that service with vision. And yesterday was the showcase and the first time that they had provided services to patients. And I was told while I was there that they, at that time, they had already seen 14 patients. And this is a state-of-the-art RV, Great Lakes, that has vision equipment that is similar to going to your eye care center. Along with the glasses, and they have many different stylish frames, such as this one I have on today. Cute. So I encourage you to check us out. Remember, if you're a diabetic or you have other chronic diseases that require vision care, please take advantage of getting your annual eye exam from credible people in the community as licensed opticians or ophthalmologists, but don't neglect your care.
Yes, the sooner you get in to see somebody, the greater chance you have of recovering and getting better.
Yes, for sure. And in addition, we have to remind everybody that flu season is approaching. Flu vaccines will be available soon, COVID vaccines as well as RSV. But in addition to that, remember our kids are suffering from measles. It's important, especially school is about to start, make sure your children are immunized for those vaccines that they might be missing. So that's why it's important that you get those kids in for their checkups now. You don't want them to become ill while they're going to school or even family members. So we service the entire family, and we are here to love on you and support you.
I love it. Angelia Williams, thank you so much for being here. As always, go to Hot Links at the top of WNEM.com, and you will be able to directly connect with the health system.